Episode 35, C Wendy and an Idaho Columnist compares and contrasts the airborne risk of wood smoke with COVID-19. Wendy noted that, in Idaho, there was more to do against wood smoke than donning a mask. Wood smoke for residential wood burning could be preempted by local ordinances banning indoor wood stoves or fireplace use if the PM 2.5 levels measured by near neighbor's fence-aligned purple air PM 2.5 monitors in the neighbor's yard show levels above the WHO standard of 5 micrograms per meter cubed or expected US standards, after November 2022 of 8 micrograms per meter cubed. Wood smoke also has long-term health consequences, not mentioned in an article from Idaho. Wendy noted that PM 2.5 can cause early death and long-term illnesses and mortal diseases in humans, as demonstrated by numerous scientific, statistical, and medical studies. PM 2.5, particulate matter of 2.5 micrometer size, is the perfect size to infiltrate the human lung, causing a cascade of human health problems. Wood smoke is 90% PM 2.5. Wendy did appreciate that the columnist compared and contrasted two airborne health risks, PM 2.5 exposure and COVID-19 exposure. Wendy hopes that taking measures against wood smoke is not as politically stigmatized as taking measures against COVID-19 is in Idaho. Wendy hopes that taking measures against wood smoke will not be a hard sell in Idaho or in the United States. Wendy noted, in an article from Idaho, called Between the Wildfire Smoke and COVID-19, the air feels like a bully, that breathing smoke for very long is not a good idea. The author wrote that smoke, of course, can be deadly for some people. The only solution is staying cloistered inside an airtight room. It's something we have to learn to cope with. Suggestions: stop breathing. Hold your breath as long as possible before passing out. Wear a mask. Considering how popular wearing a mask is during restrictions for the COVID-19 pandemic, there's not a lot of hope folks will adopt it now. Smoke, unlike COVID-19, however, is palpable. You can feel it in your eyes, your throat, and your lungs, and that might make a person more willing to don protective equipment to lessen the irritation. COVID-19 was invisible, and you couldn't always tell you'd been infected. Taking precautions against the coronavirus was a hard sell, at least in some places like Idaho, where people are dang tough and aren't going to protect themselves against something they can't see or smell, even if it kills them. Smoke can kill us, too, but it is far less politically stigmatized than COVID-19. You don't hear about smoke deniers. You don't read about government lawmakers arguing how to keep people off the streets when smoke is choking off business. And you don't have people fighting each other over whether smoke is really real or not. Smoke is a bully, and there's no denying it. COVID-19 is the enemy who hits us from behind.